ग्रुप मेरा एक सेमिनार है, उसको होस्ट करके बात करती हूँ। मैं 2 मिनट बोलना मेरे को साथ। आजकल यही सब चलता है।
मिटे अज्ञानता का की नव भोर हो, ज्ञान और विज्ञान का जय घोष चारों ओर हो। विश्वविद्यालय गुरु जम्भेश्वर सिरमौर हो, सिरमौर हो। इस हरित भूमि से जन्मी सभ्यता और संस्कृति, कर्म के पथ पर गमन मां सरस्वती की संतति।
सृजना कौशल कला और खेल का संगम यहाँ, चेतना चिंतन मनन का हो रहा उद्गम यहाँ। शोध के विस्तार का अपनाना कोई छोर हो,
ज्ञान और विज्ञान का जय घोष चारों ओर हो। विश्वविद्यालय गुरु जम्भेश्वर सिरमौर हो, सिरमौर हो। प्रज्ञा बल संपूर्ण हो, विद्यार्थी निर्भय सदा, सर्वहित में हो समर्पित राष्ट्र की संपदा।
हर शिखर अपना शिखर हो, ये सतत प्रयास हो, जीत हो निश्चित सदा, बस ये प्रबल विश्वास हो। मुश्किलों के सामने ना हौसला कमजोर हो,
ज्ञान और विज्ञान का जय घोष चारों ओर हो। विश्वविद्यालय गुरु जम्भेश्वर सिरमौर हो, सिरमौर हो, सिरमौर हो, सिरमौर हो।
Welcome, dear participants. Welcome. I welcome Shri Rajendra Harna ji. Sir, welcome. You are welcome. Namaste to this talk. And welcome our chairperson and dean, Professor Niru Vasudeva, my dear colleagues and dear students for today's talk on words of wisdom. So first of all, I request our chairperson, Professor Niru Vasudeva, to kindly share her views.
Thank you, Professor Manish. In continuation with the series of motivational lectures, this is the second motivational lecture, and I welcome Professor and Dr. Ha on this speak. I would like to tell you, sir, for this we had more talks, and that was basically on the pharmaceutics topic, and carbohydrate polymers, and one more was there. This is the second motivational talk, and most of the participants in this are our students. And to tell my students who are the participants in this talk, Dr. Hanna has been visiting this department since the inception of this department in the university somewhere in 1995, and he's known to the department very well. And whenever required, he has helped the department. And from one time to another, he keeps on coming. He used to come to the department before he was transferred to, I think, in this period, he was transferred to any other places. And he was with Haryana Drug Regulatory Bodies. I invite Professor Harna, Dr. Harna to kindly start his talk and motivate the students. Thank you.
Sir, let me first introduce you. Dear participants, मैं आपको in brief में I will tell you about the profile of our speaker of the day, Shri Rajendra Harna ji. Harna Saab is a very well known to all of us, but to students you should know he's a versatile personality. He has a large, vast experience of 48 years. Shri Harna ji first did his diploma in pharmacy from Medical College Rohtak, which was earlier affiliated to Punjab University in 1972. We were born in 1972 and sir उस समय pharmacy profession में enter किए, and sir worked as a hospital pharmacist in government hospital Haryana government from September 70 to 1976. So he has the experience of hospital also, the basic experience of pharmacist. मैं यही कहता हूँ कि सर को इतना experience है, आप कुछ भी पूछ सकते हो उनसे. Then sir joined Punjab University Chandigarh for graduation, and he completed his post-graduation M.Pharm in 1981 from Punjab University Chandigarh. Then sir joined academics and served as a lecturer from September 81 to March 82. And after that sir joined in a production as a production manager at Alembic Chemicals and Works Limited, Vadodara, Gujarat. And he worked there for 1 year. And then sir joined in Ranbaxy Laboratory Limited in the R&D department as product development officer. And he worked there for 5 years. So in that period, sir developed various formulations. And notable among them was the first formulation which was launched in India was ranitidine hydrochloride tablets. Now it is a very typical, because there's a stability issues also. And sir handled it very carefully, and he was the man behind the introduction of this ranitidine hydrochloride tablet of Ranbaxy, and also developed IV infusion of ciprofloxacin. And because he has so much of experience of R&D also, so our students would also be benefited out of this. After that, sir joined in 88 in a Haryana government Federal Food and Drug Administration as a drug inspector in August 1988. And he worked there in various capacities and as at various places in Kurukshetra and Hisar and other places also. And he was because of his knowledge, he was assigned so many work, and he has so much of experience. And he retired in June 2011 as Assistant State Drug Controller. After that, sir joined Sterile India Private Limited, Kundali, Sonipat, in September 2012, and worked there till 2013 as advisor to API production. Then sir again came to academics and joined here an institute, Manav Institute at Zevra as principal. There sir worked for 2 years, and after that sir joined Nitin Life Sciences Limited, Paonta Sahib, Himachal Pradesh, and sir also worked there for 2 years as a director. Sir has already done, apart from his pharmacy degree, sir also have a law degree from Kurukshetra University, and sir has served as adjunct faculty at the Central University of Haryana, Mahendragarh, from September 17 to December 2019. Sir has remained external examiner to Punjab University, Kurukshetra University, and our university also sir have come once. And sir has delivered invited lectures for training of regulatory officers of central government, state government, government analysts, technical persons of the industries in North Zone of India in training program conducted by NIPER. And also he has delivered lectures in various seminars in NIPER. And he has also delivered lectures Judicial Academy of Jammu and Kashmir at Srinagar. And I have recently, there was a national conference on DISO 2020 online conference, and sir, I saw sir there, and that prompted me that sir is active on online also platform. So I requested sir कि kindly sir हमारे बच्चों को भी time दो. So sir agreed. Sir has a passion for pharmacy. Sir has a strength in research development, and he is currently giving legal advice and as a consultant to various pharmaceutical industries. और इसके अलावा मैं बच्चों आपको ये बताना चाहूँगा कि सर से हमें कभी भी कुछ मुझे जरूरत पड़ी, even during my PhD work and after that also, whenever sir visited our department, I used to discuss my problems of formulation, and he would advise me. sometimes he have given so much nice ideas, and I have worked on that, and many of my M.Pharm projects have come from the ideas given by sir. तो सर से बात करके इतना कुछ मिलता है. Not only me, my other colleagues also, Dr. Dinesh Dhingra is there and other, they all have been benefited from the sir's advice. And सर बहुत बार आते हैं हमारे पास और बताते हैं, तो इसका बहुत बेनिफिट होगा. तो सर मैं आपको बताता हूँ, हमारे पास इस समय B.Pharm और M.Pharm के स्टूडेंट्स हैं और PhD स्कॉलर्स हैं सर. इसमें अभी इसमें कुछ पार्टिसिपेंट्स तो जूम पे हैं, एंड मोर देन दैट आर इन, इस समय हमारा जो यूट्यूब चैनल है सर उस पर लाइव चल रहा है, तो उस पर भी बहुत से बच्चे बैठे हैं. एंड आई हैव आस्क्ड देम कि भाई सर से आप कोई भी क्वेश्चन पूछ सकते हो. तो बच्चों ये क्वेश्चन आप चैट बॉक्स में भी डाल सकते हो जब आपको बताया जाएगा, और क्वेश्चन आप हमारे को यूट्यूब में भी उसमें डाल सकते हैं और हम सर से डिस्कस कर सकते हैं. तो आपको जो भी क्वेश्चन हो आप उसमें डालिएगा जब पूछेंगे. अभी मैं सर को इनवाइट करता हूँ कि सर आएँ, और आई रिक्वेस्ट यू सर टू डिलीवर योर टॉक, so that आपके साथ जो भी इशू होगा फिर बच्चे आपसे डिस्कस करेंगे. I have also received few of the questions. I will ask you after your words. Thank you, sir. I welcome you. I request you to please come.
Thank you very much, Professor Ahuja. Respected Madam Neeru Vasudeva, who is Chairman and Dean of Guru Jambheshwar University in the Pharmacy Institute, and Professor Ahuja and Assistant Professor Vikram Singh, and all the participants who are pursuing their doctorate or post-graduation or undergraduation. You see, I have found this profession very fascinating, very challenging, giving opportunities every day, every time, including today. As Professor Ahuja has introduced, I started my career long back in the year of 1972, where I was working in hospital, and I retired from the regulatory office, and again have been in contact with the industries. Everywhere it was a learning place, immensely interesting learning place. So what I want to convey is all the students of B.Pharm or M.Pharm or research scholars, PhD, that they should understand one thing. The pharmacy is not a basic science. It is a science of applications. It has borrowed all the principles and discoveries from other disciplines. For example, tablet making machine, its fundamental structure resembles to the slug making machine, which is used in metallurgy. Similarly, film coating, all the principles and equipment is similar to that of paint industry. So only thing is we have to find out ingredients, inputs, and processes suitable to our product. From where do we start? The starting point is at the farthest end, that is the patient. Whatever we work for the patient. Patient does not mean he should be sick. Any consumer of the drug who may be healthy even. So whenever you are working, whenever you are doing anything in the factory or even in your classrooms or in your research work, please keep in mind our central point is the patient. When you choose a substance, I'll take example one by one. Suppose you are formulating something, when you choose two things, API and the excipients. API you have chosen because it has already been accepted by the researchers, which is a separate branch for the researching in pharmacology, and that API has been approved by the WHO. Before going further, something comes to my mind. How the name of a drug is kept? Who assigns the name of the drug? A drug is given a name which is called INN, International Non-Proprietary Name. I will repeat. Drug name is given by WHO, and that name is called INN, International Non-Proprietary Name. Means nobody can patent it, right? How it starts, suppose you develop a molecule and you screen for the pharmacological activity, do all animal studies, and you find it is usable in human beings as well. You propose to the WHO that I have discovered this particular molecule and I give such and such name, it has following properties. WHO will publish it in their bulletin, and they have rules how to give a name. But first they will ask for the reaction from the scientific world, because to verify whether it is a new molecule and somebody else has different observation about it, then those reactions are sent to the WHO. WHO thereafter, although everything is done through the committees, it comes to a conclusion, yes, its pharmacological action shown is all right, which has been proposed by the inventor, and its physicochemical properties he has given by and large, and he will give, the WHO will assign a name according to their rules. They have certain rules. I'll tell you, the rules are such that the name of a drug assigned by WHO will tell you the pharmacological category. How a name can be proposed? Number one, from the pharmacological action, or from its chemical structure, or from its origin. Certain drugs which don't have a pure composition, or which are not pure composition, or not known, which are mixture of some complex substances, then they are given depending upon its action or its source, from where they have been obtained. So these are the four principles how a name of the drug is given. So aspirin means aspirin everywhere. Paracetamol means paracetamol everywhere. The brand name will be different other than paracetamol. And if you see, you read any drug, I will advise you must consult Merck Index. This is a Bible for any chemical. If you see the Merck Index, the first thing will be given CAS number, CAS, CAS number. Everybody who is in pharmacy must understand what is a CAS number. CAS means Chemical Abstract Service. It is a unique number assigned to each and every molecule synthesized by man or found by man in nature or made in laboratory. Whenever you are publishing your papers or you are referring to a particular substance, which is API or even excipient, if you keep CAS number in your record and mention it while ordering the substance, you will always get the same thing. So we started from how when we are selecting an API, when we are selecting excipient, our focus should be whether it is suitable for the patient or not. I have seen, even in Punjab University also, some researchers, they picked up certain things made up and at the end, during the external examiner asking them, and they had not bothered whether this substance, say, I make a maleate salt, I make permoate salt or something else. The major molecule is known to be an effective pharmacological drug, but it's for its changing its physical properties, we may use different derivatives as salts or esters. The second part, whether it is toxic or non-toxic, they had used everything, whatever came to their hands, and many of them were toxic. And what I'm talking about the research level at the doctorate level. So starting from very beginning, being even in B.Pharm, M.Pharm, or doing doctorate, please take care whether these substances have been found to be non-toxic or not, even if it is an excipient. Recently, there was a case where a big company like Novartis, they made a, and its injections find very quite used. Its dose is 75 milligram in 1 ampule of 3 ml, means 25 milligram per ml, and the 1 ampule is of 75 ml. And its solubility is very low. Sodium, diclofenac sodium has a very poor solubility, and this is even today big problem, and somebody can take up in their doctorate or M.Pharm study. It is very interesting. In M.Pharm, for M.Pharm study, it's very interesting molecule. So it has a very low solubility, although it is a sodium salt, but its solubility is very low, and its solubility is pH dependent. At pH 8.2, it remains in solution in the presence of propylene glycol around 40% or 40%. Alone, it cannot go into solution. And still, to avoid any crystallization, benzyl alcohol is added up to 4%. And some people, they make a use up to 10% of benzyl alcohol. You see, benzyl alcohol is not that innocuous. It is used as a preservative, as a half to 2% volume by volume, but it is not that innocuous that you can keep on using it to any extent. Every excipient in every drug is safe only in brackets. There's no excipient, there's no API which does not cause any adverse reaction if it goes beyond the safe limits. So when we say it is safe, it means within the limits which are available in the literature or official books. So diclofenac sodium, to dissolve it, various approaches have been used. And one of the approach was one derivative of ethylene glycol coupled with polyoxyethylene, and that was used by the Novartis. And upon keeping it hydrolyzes to give off ethylene glycol. You know, ethylene glycol is very poisonous substances. Poisonous means, I would say it's very toxic. I should not use the word poison. I should use the word toxic. Toxic substance. And the firm which had already patented another method, they challenged it in Madras High Court. And Novartis lost the case because they had not done complete studies. There was big competition because of the price. A normal 3 ml ampule of diclofenac injection would get an MRP of around 3 to 4 rupees only. Whereas that new invention, which was patented by the Ahmedabad company, that they had got approval of 18 rupees per ampule. So there was so much of difference. That's why there was more maramari. Who makes it? But you cannot infringe upon the patents of the other. So that even today in the market, only that particular Ahmedabad company, they are having their share of this. Novartis had to stop its production. Why? They did not bother of the solvent they were using. It was a co-solubilizer they were using, which was a polymer. Even today, the company which has got the patent, it is not free from the toxic effects. They are also using polymeric substances. They still show all polymeric substances. They can show anaphylactic shocks. All. Higher the molecular weight, more is the risk. Smaller the molecular weight, less is the risk of reactions. So the preparation, I would not say it was diclofenac, the preparation of injection because of these co-solvents used. That was, even today, I have observed myself in several cases, I have been in touch with them, that it causes anaphylactic reaction. In case we can find a solvent or co-solvent which can dissolve diclofenac without using these long chain polymers which are being used as solubilizers. This is a big area for research, and it will be very paying. When we start research, we don't think of how much it will be paying. It is only the possibilities, what better formulations can be done. So while selecting an API and while selecting an excipient, our focus should be, it is going to be used by the patient and what it is going to do in the patient. The principle behind it, do everything with understanding. Please do not do anything which you don't have understanding about. Please understand that API, even it may be a starch, it has a lot of stories still untold. So depending upon the use, depending upon the route, depending upon the API, depending upon the pathophysiology of the patient, you must screen it, whether your API or excipients are going to interfere or not. And even in, say, pharmaceutical chemistry, while doing reactions, I have personally seen, even in Punjab and elsewhere also, that several researches are withheld because of one step. They are near to the end, but one step is not working well. What to do? How to do? Everything starts here in the mind. The research is in the mind. It is not in the test tubes. Test tubes is a translation of your thought. So first of all, you must understand every component what you are going to use. I'll tell you one example which I faced in MPharm. My revered guide, Professor S.K. Bawecha, in Punjab University, I did MPharm under him. He asked me in MPharm what problem you would like to take. I told him whatever you tell me. He said, okay, your senior had worked on something. He had come to the conclusion that it cannot be done. Would you like to continue from that and see whether it cannot be done? I picked up that. Okay. So the advantage was he had done, my senior was very brilliant man, gold medalist throughout. Today he is based globally very at high position. So in MPharm, he had concluded that we are going to take tannate of diethylcarbamazine as a for sustained release purpose. So he had concluded it cannot be made. He told me, I never knew whether it can be made or not. But what I did, simply to understand what is diethylcarbamazine, what are its physicochemical properties. It is available as citrate only. So I extracted the base by basifying, I extracted the base and studied its properties. And tannic acid, I did it from where I got the lead from his work, my senior's work. And I found, the solvent was isopropyl alcohol. Simple, very simple thing. Same thing he did, it did not form adduct. Same thing I did, it formed the adduct. So at that time, he had gone in industry, and during holidays of his vacations, he came to the department and discussed. When I told him it has been done, he did not believe it. So I told him I can do it and show. Simplest thing is, follow a principle, science favors none. And that is the basis. If I say this can be done, then any second person should also be able to do by following the same procedure, method. So my science favors none. I'll show you just now. I had the materials ready. I showed him. He said, but I did the same thing. Why did I know what had happened at that time? Although I had never seen him working. What was the problem? I told him the bottle of IPA. You use this? Yes. BDH bottle was there. I also use this. Diethylcarbamazine is diethylcarbamazine base. Okay. Tannic acid, whatever he was using, I also use this. Manka, you did not read the label. I said, what? Manka, you did not read the label. It is isopropyl alcohol. And you see on the left hand side and right hand side, there are certain things written. Out of that, they write the limits. Now, what are the other constituents and their limits? So it was containing water 2.5%. And that was preventing that reaction. So I told you, when I read this label, I don't use anything until I read a label from top corner to down. I don't use anything. So when I read the label, the first thing was water content. That was not more than 2.5%. And I am very fond of using KF. Immediately in our laboratory, KF was there. Every student used to do it himself. I found it, yes, it was near to that. Then I thought how to remove water. Basics of B-Pharm are very big things. Throughout your life, they guide you, everywhere, howsoever you technically climb. So, sodium sulfate anhydrous heated in oven at 250 degrees centigrade for 3 to 4 hours, allowed to cool. I took 1 liter of IPA, added 100 grams of that, kept overnight. Next day, decanted. Now the water content was less than 0.3%. I used that. And things happened within few seconds. Then that metal was sent to CRI Lucknow and they confirmed it. Similarly, we followed for pamoic acid, ammonic acid, what it's called, and that was also very successful. He was very much shocked. Such a small thing can prevent my 3 or 4 months' work. It did. And I could do it within a few days. Why I am telling this is not a big achievement. What I am telling you is by going into the detail of a substance, you can ward off several obstacles which may go unnoticed. Once you have committed a mistake, it is rarely you yourself will find it out. Somebody else may find it out. But you yourself, you have already engulfed it and you have made it a part of a proper procedure. Actually, that point is not proper. Therefore, before starting any work, even at B.Pharm level or M.Pharm level or PhD level, try to see what the things are participating. In chemical reactions, solvent is the majority of time ignored. The containers is ignored. So try to understand how to treat that solvent with the reactants. It also again happened in Punjab University. At that time I was at head office in Panchkula. So somehow I used to visit Punjab University. I like going there also. So what I found that man, I was waiting for the teacher I wanted to meet. He told me my reaction is not working. I had not worked on that compound. I asked him, show me the position where you want reaction and show me the molecule with which you want to react and tell me the solvents. So I do not know the full structure of that. We did that. We talked about what will be the solubility of the end product. And ultimately, what I found that I suggested them 3 solvents and 3 temperatures with which he could do it. So we should not see only the reactants, we should also see the role of the solvent in that, what is happening there. So while studying B pharmacy or M pharmacy or PhD, please take care that you are going to make this dosage form or this chemical substance, or even it may be natural product, and it is going to be used by the patient. If you have done basic study completely, you will find that you have reached your goal. My experience in R&D is that if you can logically put your all step one after the other to reach your designed product or designed molecule, it is not possible that it will not happen if you have not missed any step. It has never failed. But you have to do a lot of study before that. So that concept should be kept throughout while studying pharmacy, every time, everywhere. And you are in a very good institute here in Guru Jambeshwar University. The teachers have built up with their sweat and blood to the level as you are enjoying today. And they are very competent. It depends on the student only, how much he can extract from the teacher. Teacher will give certain minimal formal education, but he has a lot of reserve, he has a lot of concept, he has a lot of strengths with himself. And if you are able to interact and tell what are the outcomes, what do you think, even hypothetically you are thinking, discuss with your teachers so that you may be bringing some new idea, you may not be in a right direction, you may be corrected at a particular time. This field is so interesting that even in B.Pharm you can contribute a lot, despite what is your syllabus. And that can only be done if you are interacting with your teachers. You can take up small projects, simple things. Please remember, all the complex things have been made by very simple things. This whole big universe is made by very simple units. And all the processes, if they are broken into those small processes or basic processes, they are these very simple and they are the same. Therefore, in B form, if you develop a good understanding of the basis, you will find throughout your life, those bases are finding place in everywhere. Whether you become a teacher, you become a researcher, you become a scientist, you become a production person. If you remember the basics, they are going to help you throughout. In M form, you'll find you are given an opportunity to understand things and design. What you can learn in M form is designing of experiment. It has become very important topic nowadays. How to design an experiment. Why? It saves time. A properly designed experiment will be very, very useful, whatever data it generates. Haphazard working will lead to more confusions, and it may not be a credible work, even if you have done very credible work on your part. Therefore, whatever you start your work, be very systematic and document it and go logically. Nothing, don't swallow anything. Okay, let me see, it will happen. Out of box thinking is required many times. That is a very characteristic of a researcher, out of box thinking, and it does give a bit edge. But principally, initially, one should go very systematically and one should not go out of box system. If you develop this culture in this institute while doing research or while doing your MPhil or while doing your undergraduate studies, these things are going to help you immensely in your working place. Ultimately, why we are studying? To get a good job. What is a good job? There is no job which is called a good job. You have to make it good. That is the basic principle. Do not feel that there is some good job which will come to you. You will find all jobs are jobs. It may be in manufacturing, it may be in R&D, it may be in teaching, whatever it is. Every job has to be made good by you, depending upon your capabilities, environment, and the content you have to handle with it. So develop a thing that we should not search where is good job. Whatever job you pick, make it good. And skies are the limit. Next question comes, we get a job, but what is the salary? Let me finish first part. How do we get a job? I participated in the Sunday conference done by your department, Dr. Manisha Ahuja, and that Rimple had put very valid, very clear things before you. So how to get a good job? The method of applying it is necessary because it is a communication. Without communication, how somebody will know that there's some job seeker? But what I understand is there's no dearth of jobs in this farm industry. Only thing is, competent persons are not available. I remained in Nitin Life Sciences. I was director there. I was also assigned the job for the new recruits for the technical staff. What I find, the first question is how much salary I will give, means the company will give to him. I told them, you write down, I will get that much. But you have to answer my questions. The concern should be finding a place where you can develop yourself and become useful to that organization. Only then organization will be able to pay you. So don't worry, you have done a very good education in pharmacy. It will never happen that you don't get a job or you don't get a good salary. But by choosing a salary, then finding a place, it will be next to impossible. You find a place, start with organization as per your perception. All organization have to be good because the standards required for the drug and compliance is same, whether it is a small size or big size. Big company means big turnovers. Small company means small turnovers. That's all. As far as quality is required, both have to comply with the same quality standards. And any of them, if they do not comply with, they have to be subjected to the same punitive action through the prosecutions. And this is regularly happening. It is not, this is not happening. But the companies who, or the organization who take care at all steps and do something extra than what is legally required, they find a better situation to survive. Who does it? Who runs the company? This is you. It is your concept which will work. So when you are fresh, you go to a place, please don't have liking and disliking. ये काम तो अच्छा नहीं है. I will like to go only to quality assurance. I found this trend that majority of boys going to quality assurance. The boys who used to prefer production area because the production people used to be more paid. 3 wings are there: quality control, production, and QA, where R&D is not that. So why quality assurance? Because there is mostly documentary work. This is a wrong concept. Quality assurance person must know the very basics of the quality control as well as the production. Without that, if he becomes a quality assurance man, he becomes copy-paste. Majority of the quality assurance people coming from other units to some different unit, what they are doing, they are bringing some data. They are bringing some printed material in their pen drives and putting at the new place, changing here and there wherever changes are required. This is not the way. I have seen an SOP of the company where an SOP for the injection was included with the appendices of tablet manufacturing. The man had not bothered to see what I am going to do. He had simply brought the document, and during interview, he might have not told everything, but in interview, nobody is expected to know. And if you feel, if I have not done somewhere, I cannot do here, it is not the case. The organization wants to find a person who is capable of doing when he is assigned a job. If he has not done in the past, it does not mean he will not be able to do it now. It is only the technical background he should know, understand the final aspects of that. So becoming a QA, being a choice, not going to production because you have to work in the night also, and going to R&D because there is no pressure of production and this and that. These are not the factors which will give you success. This success comes from your own heart. If you like to do what you are doing and be honest with yourself, whatever job you have taken today, even doing small experiment in your B.Pharm lab, please do with heart and soul. If you are writing it, put your heart and soul. and always find a method. How can I write in a better way? How can I do it in a better way? And that is essence behind this pharmaceutical industry. Doing better than yesterday. That attitude everybody can adopt without getting any training. You have to train your mind, and especially those in research. Don't give up. Don't say कि इसका कोई solution नहीं है. I'll give some example here. इसका कोई solution नहीं है. There's no way. ये तो हो नहीं सकता. One example I gave you. Now I give you another example from the manufacturing unit itself. The company which I am talking about were big company, means big turnover, around 400 crores per year, and were making only injections and sterile eye drops. Injections have to be sterile. Eye drops are also supposed to be sterile. Now you should think why eye drops should be sterile. We will not discuss here. So in the eye drop production, in the production area, there were two eye drops. One was olaptadine, which is anti-allergic, and the other was moxifloxacin, which is antibacterial. Both were clear solutions. Both contained viscosity imparting agent. Both were filled in 10 ml PP self-locking vials, and the company had a big sale about it. So they had made these two products, kept in quarantine. You understand quarantine? Quarantine means separate area, in which a material pending the next step is kept, so that it doesn't get mixed up with something else. So, but it is these vials were filled and kept in quarantine separately, so that they cannot mix up. But that was a big hall. The quarantine area was big hall under temperature and humidity control. So what happened? They had taken up olaptadine to be labeled. So you know, nowadays every labeling is mechanized, high speed. In one day, in 10 hours, 8 to 10 hours, they would fill around 2 lakh of vials. So that's a good speed. And just going to do it, they got a message that regulatory people are going to visit. So they removed the product from the plan and put some simple product so that the area is not very congested. Because these plastic vials, they sometimes fall from the line and show a bad situations. So to regulatory, majority of people, they put a good presentation. So they changed the product to some glass vial, 30 ml glass vial. And on that day, that regulatory inspection was over. So next day, they started with olaptadine. Now, when the vials were kept back into the quarantine, after changing the plan, the worker kept those vials near to the moxifloxacin vial. Next day, when olaptadine was taken, the manufacturing chemist took certain bags. Each bag contains around 1,000 vials, and on the bag there is a big label containing olaptadine batch number, expiry date, and that bag is picked up and brought to the labeling line. While labeling, you know, this is a sealed vial, sterile vial, and on the machine it runs and label is pasted and batch number, expiry date, etc. quoted. After 3 or 4 hours labeling, it was found that the number of bags which would have been left for olaptadine is not that less as should have been. Means they are more than they should be. So what was the meaning? Means something else has come into it on the labeling line. The workers thereafter, they picked moxifloxacin. And when there is a work, those who have worked in factory, we unfortunately have not trained ourselves to read. We don't read. We go by the size, color, location. वहाँ पड़ा है सफेद रंग का, उठा लो उसको. Instead of reading the vial, reading the label, we just what time. First time I may read, second time I don't read. Third time we don't bother at all. Simply go to that location and pick up and bring it. So that happens. So vial labeling along with the olopatadine vials look alike. Moxifloxacin vials also came to the labeling belt. And ultimately what happened? There was mix-up. Mix-up of olopatadine labeled vials with moxifloxacin vials labeled, coded with the batch of number of the olopatadine. By counting the remaining bag, they could understand. But how to find out which vial? Because the labeling and packing is continuous. As soon as the labels are pasted, then there is a physical inspection of each vial, and then they are put into the shipper after putting into the cartons. So there were some cartons containing both the type of vials. How to find it out? I would like that you think over it. The vial is opaque. The contents cannot be taken off. You open the vial, the lock is broken. That vial cannot be reused. The solution contains viscous substances and is sterile. It is difficult to recover because next time the aqueous solution containing viscosity imparting agent cannot be filtered. And they are mixing the viscous substance and the main solution, they are mixed by aseptic method. So sterility will be lost and cannot be corrected. Vials cannot be reused. And the vial is closed. So there's no mark, nothing. And same 10 ml, 10 ml. If you weigh them, there's no significant difference on the basis of which you can separate the two products. This happened. Now, when it happened, so the manufacturing chemist, QA, QC, everybody gathered in that area. The packaging person that also was there, workers were there, further labeling was taught. The top people, they came to know, they called me, do you know about this problem? I told him, no, I do not know. He told me, please check it, there is some problem. I went there, they told me, this is the problem. So what are you thinking? So what they were thinking, how to find out what is the percentage. See, if we take 100 vials, how many vials will be of the other products? This is very wrong thinking. Nobody should have a thinking like this. Even if one vial is going wrong, that is really very serious matter. It is in the category of spurious. And think about the patient who was supposed to take olopatadine, he will get moxifloxacin, or who was supposed to take moxifloxacin, he will take olopatadine. So something clicked to my mind. I had something in my mind that the properties of moxifloxacin is slightly fluorescent. It gives pale yellow color if it is exposed to normal light. But this is a thick-walled vial. Thick means it is around half mm thick. The vial in which is it filled is half mm thick. So I asked the QA, you give me a torchlight. He lit his mobile phone and gave to me. I directed it onto the vials obtained from the control samples of the previous batches, not this batches, of the previous batches. And it was found that the whole of the vial containing moxifloxacin will turn pale yellow from external light itself. And the olopatadine vial did not show any such change. So without destroying even a single vial, the company could separate by examining it against the visual light in the area where MPUs are visualized. For visual inspection they are used. So there is always a way to find. I have never handled moxifloxacin, but I do try to update myself with various new APIs, new dosage forms, new products which are coming. So updation is a must. If you keep on doing, you will find you have edge over the others. So for getting a job, you should prepare yourself and be honest in your interviews. Whatever you can do, tell that. What you have done, you can tell that. And if you do not know anything, do not be worried, and nobody will be rejected for this particular purpose. If he fails to tell ki I cannot make, I have not made, I do not know about it, but you are capable of doing it, you will find out, explore, develop a method, and do it depending upon what positions you are. Second part is, once you get into the job, what to do? You see, pharma industry is totally concerned with quality of drugs. All the things, and you should be happy that your job is reserved under the Drugs and Cosmetic Act. No pharma industry can run without having approved manufacturing chemist, and for whom the qualification minimum is only B.Pharm. And for analytical chemist, it is B.Pharm, or it can be a BSc with 3 years experience. So your posts are reserved legally. Now, once you get a job, what you should see so that you can grow there, you can excel others. Please don't be in competition with this idea. He's getting more salary, I should please somebody, people, request him, be in good books, this and that. My experience is you should be good in your own books. You don't have to be good in anybody else's books. Everybody else is watching you. When you go to your company, you are under test. So many eyes are watching you. You are under constant evaluation, even by the worker and by the all persons who will be coming in contact or are connected with your work. So once you join, the first thing is, what is in pharmaceutical? Is good manufacturing practices. People go and attend big seminars, attend conferences, big books. If you are habituated to do your work from your undergraduate level, going through M.Pharm, PhD, or what additional qualification you find out, develop a things, do the things right in the first place itself. And do not use anything which has not been identified or which has not been labeled. If you develop these things, you will develop the concept. These are bases. You will develop the concept, and your hands are slave to your mind. Hands don't work. Hands obey. Feet obey. Only your mind works. So you can carry all knowledge in your head. You read a book. If you have understood that part, it will go to your head. And it will be in subconscious mind and will come out whenever you find its necessity without knowing whether you know it. So when you go to a company, please be clear. You are to develop. It is not I'll do for tomorrow. Those who want to start your career, you must start today. From today onwards, how to do a work. First is how to approach. I ask in interview, when you reach the factory, what do you do the first thing? Then what do you do the second thing? And what do you do the last thing when you come out of the factory? If you have this picture in your mind, it means you have made a plan for working. And if you are totally unmindful, unprepared, unplanned, You will go and then think what I should do today. There is a big gap. You will have to labor to the same extent. But difference in this thinking will make a difference in your whole life. So good manufacturing practices means doing all activities in a planned manner according to the specifications by the authorized persons, by using authorized processes, using authorized documents, using authorized place and machineries, and taking care that deviations are not done. I may claim I know that much. I can make. You tell me any formation I can make. Maybe I'm able to make, but I'll not be authorized to do everything, whatever I know. I must stick to the norm. I may be knowing some better methods, but I cannot do it of my own. So for good manufacturing practices, the first part is the commitment of the management. Then there should be quality manual. Then there should be qualified persons. Then there should be written documents. Then all production should be done according to the written documents. Nobody is allowed to make a change, however qualified or experienced that man may be. If any change has to be done, that's for deviation. It should be processed through a deviation protocol, which will be authorized. That change will be generated by the person who will be using or at a user side. That will make the start the protocol, and it will be ultimately authorized by the quality assurance head. Please do not try to copy anybody. Do not try to copy any document, but you may have to copy the format provided by the company or by the organization. If there is none, you can make a format. What are the essentials of the format? Every format must have three things. Every process must have three things. That is time, place, and person. You do anything, your document must demonstrate who has done it, when he has done it, and where he has done it, besides what he has done. Therefore, the good manufacturing practices involves all written instructions, and in a approved format, you can design your own. Sure, the format should reveal all these three things. But when you make, you'll find you have to give places for various things. No unapproved document should be used or be available in the manufacturing area. There is no better instrument than the human eye itself. If you are vigilant, use your eyes and mind together, you may prevent any big mishappening which might have happened due to any unforeseen situations. So by following good manufacturing practices, this topic being very big and required a separate big time to discuss about it, I simply wanted to tell you that good manufacturing practices start from the institute itself. How you handle your practical notebook. I instilled this practice wherever I got opportunity, that in practical notebook, you write whatever relevant details in a particular manner every time. And you should write which equipment you have used, how much time you have stirred, how you have filtered, etc., etc. And you will find that GMP is very simple for you. You are already complying with that. Similarly, in say research is thought to be a thing which does not have a railings or limits. It is not so. A research work should be credible only when it has been documented real time. Whether you are doing MPhil or you are doing PhD, please continue. Please apply the same principles of GMP, what you would do after doing your PhD or MPhil. Don't think that is a different. You see, Dr. Ahuja told me in various fields I have worked, I have never found a difference. People used to ask, earlier you were in production, now you are to R&D. These two things are separate. For me, no, I have not found any difference. Mind is the same. From there, you go to academics, mind is the same. Science is the same. You go to the regulatory, science is the same. People never believed when I said this. But reality is that same principles, same way of working, same concepts are applicable everywhere and they give very good results. So whatever you will build here in the institute, that will become a part of your life. So have good habits, which is called GMP. Once you follow GMP in a factory, you will find that goodness trickles in your own personal life also. You become very conscious and you would like to do everything in your life also with that. Should I answer some questions? Do you want me to answer some questions?
Yes, sir. There are a few questions.
Yes.
So I will let you know.
Yeah.
सर आपने एग्जांपल्स बहुत अच्छे बताए और मैं कुछ थोड़ा सा वैसे बताता हूँ जो आपने बताए जीएमपी और ये सब ये स्टूडेंट्स आपने बहुत अच्छा आइडिया दिया। कुछ स्टूडेंट्स का ये है कि यहाँ हम जो रिसर्च करते हैं हमारे पास फैसिलिटी कुछ खास नहीं है, लेकिन जैसे आपने बताया कि हम छोटा सा काम भी कर सकते हैं, एग्जांपल दिए, तो देयर वर स्टूडेंट्स हु आस्किंग मी फार्माकोलॉजी के यहाँ, जैसे आपने स्टूडेंट्स के बच्चों को एग्जांपल दिया कि डाइक्लोफेनाक सोडियम पे भी आप काम कर सकते हो, यू कैन मेक दिस फॉर्मुलेशन। सिमिलरली देयर आर स्टूडेंट्स ऑफ फार्माकोलॉजी एंड फार्माकोग्नोसी आल्सो एंड दे से कि हमारे यहाँ ज़्यादा फैसिलिटी नहीं है, तो सर कुछ आपके ऐसा कुछ एग्जांपल हो, आइडिया हो जिसपे कुछ स्टूडेंट सो दैट they come to know कि भाई हाँ हम इस पे भी कर सकते हैं।
Yes.
Mainly for research students.
Should I speak on that?
हाँ जी सर।
Pharmacology, you see, the most interested part, if you take it by heart, pharmacology, and a lot of things are yet to be done, which you can do your own lab, whatever facilities you have got. It's not difficult. You should feel very lucky for pharmacology students that you have an animal house. Majority of people, especially in private colleges, animal house is not there. Pharmacology without animal house becomes a big hurdle. In pharmacology, I would say go by the big terminologies. For example, this COVID has come. Now everybody will say, I'll synthesize drug which will act against this virus. First, I must know what is the virus. I must have a laboratory where I can sustain such activity. And then I should have some concept. I should have a lot of data. But today, the data is lacking, or proper understanding is lacking. So don't run in the dark. My point is, look at whatever laboratories, and I think your laboratory is well versed. I have been sitting with Dr. Dhingra, Dr. Parle. I found on psychopharmacology they have very good, and our one teacher, the most celebrated teacher, Professor S.K. Kulkarni, he used to do all the experiment in his office only. Now this is the selection of design of experiments. What he used to do, he worked on psychopharmacology. He used to take mice is kept in the cage, and they would be near his table and chair also. So he had an instrument, he would drill a hole and instill the drug. and put them into the photoactometer and watch their activities. No, all activities in CNS. Such a simple arrangement is required. Such a simple, why students, those who are doing research or MPharm, should not choose such problems where the present space, equipment, and other supporting facilities, they can be done. You see his publications. He was a student of Dr. P.C. Pandya Dandia, P.C. Dandia. And he continued his line, and he has published so much of work and students. So the best warrior is he uses whatever weapon is available. Similarly, in research, don't run after the facilities. Whatever facilities, or if there is some point of facility which is must, then you go to some other institute for some time. I again tell you an example. When I was doing MPharm, my senior professor, Dr. K.V. Rangarao was there. He was doing his PhD work, and his work was nearly complete. Only SEM studies was required. Scanning of by electron microscope of his tablets, whether the film coated don't have any defects. The release was through the defects or holes, or what was the mechanism. So in Punjab University, one day he was very sad. What had happened, sir? He was very nice, very gentle person. Nowadays he's in Germany. So he said, my work is almost very good, but it is lacking that electron microscope scanning of my tablets. And I will have to go Bombay, TFRI, and I do not know how much time it will take, maybe 3 months, 2 months, and this and that. So when he told everything, I was surprised. Sir, it is available here. Scanning electron, my SEM, it is available here. He said, what are you saying? It is not here. You see, when I used to study there, I never used to run on the roads. I used to go through the galleries of the departments and reading what is written here. So in geology department, I had read. There was a plate where SEM was written. I told him I've seen it. He said, okay, take my cycle. In those days, cycle was the vehicle. So I took his cycle, went there. There Dr. Kapoor was there. He told me everything, and his problem was solved within 2 days, for which he was not sure how people will cooperate, whether we will be allowed to do something or not. And that professor was so happy. He said, this instrument can be put to use in pharmacy also. So know your surroundings. If something is not here, it is in the biotech department, make a relationship and try to use their facilities. Or say in HAU, please make use of it. Now I come to specific example for cognosy also and for pharmacology also. First, pharmacology. You see, I would strongly suggest that they should try to study screening of non-aqueous solvents required for parenteral injections. Non-aqueous solvents required for parenteral injections. Several drugs are coming which are not soluble in water, so you have to make use of non-aqueous solvents to solve them, or solubilizers. So solubilizers, majority of them are polymeric compounds. Very few flow. Then there are some good solubilizers, I would like to say. Niacinamide. It's very good solubilizer. But again, how much dose you can give as injection? Benzoate is known, very known since ages. Similarly, recently for benefit, benzoates complex with curcumin. Your interest. It has been reported. So for non-solvent, out of non-solvent, you see there are only 5 solvents which can be used in parenterals. And most commonly used is propylene glycol. Propylene glycol has a big problem. It may be contaminated with diethylene glycol or ethylene glycol. Not because they are produced during making it, but because all 3 are same in physical properties and chemical properties. Propylene glycol, ethylene glycol, and diethylene glycol. They look alike. Their physical properties are similar. They are difficult to be analyzed by simple chemical methods. They don't have any double bond in them. So we know they can only be detected with the help of GC. This is an expensive instrument. So propylene glycol is being used in almost 98% of product where co-solvent is required. And hazardous episodes have taken place, 9 throughout the world. First in 1937 in USA. Very large number of people died. At that time, it was not known whether excipient can show their own action also. And the drug was sulfanilamide. This was the first sulfa antibacterial synthetic drug. For dissolving that, the pharmacist, at that time this word was not there, the chemist, he made a solution in that and administered. So many people died, children and adults both. Thereafter, this testing of API, toxicity of, excipients, that started. Earlier, it was not started because earlier used to be sugar, starch, talc, which were already known to be non-toxic. Then thereafter, this toxic studies of this drug. Present scenario is there are not many, only say 5-hydroxyethanol, phenylethanol, 5-hydroxyphenylethanol. That can also be used. It has a very rosy smell. What you know, it is also used as a preservative. That can also be used as an injection. Benzyl benzoate, it can be used for oily injection, not for aqueous injections. And I told you propylene glycol is most common. And there is one solvent called ethyl lactate. I would request pharmacological MPharm students or PhD students. It's not a big word. One in MPharm it can be taken. Ethyl lactate. It has excellent solubility properties. It is known. It is not a new compound. It is known since ages. And there are certain reports, very small concentration have been used in intravenously in experiments only. It is a green liquid, totally non-toxic. But suitability to the route of administration may have to be studied. It's not available on the literature. It's easily available in India, very cheap, maybe 60 rupees a liter or something like that, equivalent to propylene glycol, this and that. However, it has a drawback. It is an ester. So in alkaline solution, its stability is limited in alkaline solutions. But can be used as in intramuscular injections. No studies. It should be done. Because it have a physical esters, they normally cause burning sensation, even if they are, I do not know this one causes or not. Intravenously, it has no problem at all. But what maximum you see, its hydrolyzed product is ethanol and lactic acid. Both are physiologically acceptable. It is such a good solvent, it can be used in cleaning the machines and put it to the direct drains. In laboratory also, wherever you find some corrosiveness should not be there, you use it as a cleaning agent. It will remove every greasing. It has a very high solubility, non-polar compounds. So they should explore such liquids which have been cleared for their acute and chronic toxicity. Such solvents which are available in the literature, which do not show any chronic or acute toxicity, they should be screened for their route of administration and their concentrations. This is big thing in the market. Why I started with diclofenac, there it is must. I would suggest now, give a project to someone to formulate using ethyl lactate for diclofenac. It's a 1 ml ampule requiring 75 milligram of the drug. Already this is there, but they are using polymeric substances which do show anaphylactic shocks. It is not there, this is very little, it's quite frequent in every city, in Hisar, in Delhi, everywhere. It's not particular locality oriented. So similar solvents, finding out, and especially I'm saying, M-Form, such projects should be, which will find industry. Basic principle should be, I should not do a thing which will not find its use. At least in theory, in concept, I should, before starting, I must know if it is found to be non-structural, where it will be used. If it cannot be used, why should I waste my time? It is applied science. It must have applications. Second is, this in pharmacology, don't go for new molecules. Find new uses of the existing. That you can do in your laboratories. Because lot of data is coming for the cardiovascular diseases, and this COVID-19 has changed the scenario totally. It has exposed the possibilities. What are the possibilities of research? Too much, tremendous, starting from your hand spray, going up to your very sophisticated molecules which have come. Here also, I have touched the word hand spray. This is for the pharmaceutics. You should start studying samples from the market which claim hydrogen peroxide on its label. In the market, this hand sanitizers, they are claiming 70% alcohol, ethyl or isopropyl, plus H2O2, plus what else is there? Glycerin. Glycerin is humectant, alcohol is the disinfectant, and hydrogen peroxide is also very quick, very effective disinfectant. But this formula was given by CFDA and WHO as an extempore preparation for the pharmacies in hospital. This is not the formula for the industry. Those who want to give a shelf life of 3 years or 2 years or 1 year. Because hydrogen peroxide is not stable. So we should do a good academic research over it, taking some well-known brands, claiming hydrogen peroxide, putting them in stability chambers, and making protocol. First, make a protocol, how we will do. A committee or 4 or 5 persons, senior person should sit, हमने इसमें क्या-क्या स्टडी करना है, उसको हमने कैसे-कैसे एनालाइज करना है, उसका एक प्रोटोकॉल बना लेने का. Then you give to the students कि आप ये करते रहो, इसका जनरेटर कम से कम 6 months data generation at 40 degrees centigrade, 75% RH. That should be done. And let us see how many products show. I'm sure after 1 year, none of them will show even identification of H2O2.
Some other questions, sir. Let me take very fast. Sir, एक question है. Student ने पूछा है कि when the medicines get जब उनकी shelf life expire हो जाती है, तो what the company do with these expired medicines?
Yes. First, we should understand what is expired. To my dismay, majority people don't understand. I am talking in legal terms. In Drug and Cosmetic Act under Rule 96, Rule 65 and Rule 109 and Rule 110. Only these are the 5 places where this has been mentioned and defined. Under Rule 109, they have shown here how the when it is done 10/22 means 10 is the month and 22 is the year. So the expiry date means last day of the 10th month of that year. Expiry date printed on the drug is a date after which the manufacturer can disown his liability. It is not the drug has actually ceased to be effective. First part is that. I have got trimethoprim sulfamethoxazole got tested after 10 years of its expiry date. Expiry date was 3 years, expiry period was 3 years, and after 10 years, somehow I got the sample during working as a regulatory, and I got it tested. The content was by the analytical technique what we had. Usme wo near to OKI, means within the 90 to 95 to 100% ke limit mein aa gaya. Does that sulfamethoxazole loses activity? No, it doesn't lose. Trimethoprim loses the activity. But the Act says no drug will bear expiry period more than 5 years. That is to give safeguard that even excipient will go under. So we, while studying this shelf life in the laboratory stability studies, we only analyze the API and its content and any physical changes which are visible. We don't find the chemical changes happening within the API, although we know it is very rare it will happen, but it does happen in certain situations. For example, morphine with amino groups, say lactose, morphine with lactose, the content of morphine goes down. Any sugar you add, content goes down. But the question is, the expiry date has been crossed. Then what we do with this? There is only one way, that you crush it and destroy. They cannot be used to recover the chemical, even if it is stable. It is not perfect because we do not know what other changes in science is not perfect. It is continuous. The data available is not perfect. It is only as we know today. Day after tomorrow, many things may come up. Therefore, the drug which has expired should not be used. It should be destroyed. If you have some dealer is there, and then he should inform the regulatory or may not. After expiry, anybody can destroy. And then the question is how to destroy it. How to destroy it? If these are tablets, you peel the strips and put into water. And capsules like that. Ampules, crush them. Vials, crush them. And there are machines, hammer, Hatter machine, you can crush them. And bury it in a pit. It is not to be thrown into the. Recently, only yesterday, I got a call from the regulatory. There's some news that at somewhere some drugs were found, expired drugs are heaped. So it will cause environmental pollution. Okay, so what should they do? Nothing to be done. Simply you make them unusable by peeling it or by crushing it and bury it in a pit. Nothing is to be done. It is never to be processed, reprocessed. There have been certain reports from Ghaziabad or somewhere else that on one upon a time, some gang was detected. Those who were unpeeling and selling to somebody so that he can restrip the drug. This is unfortunate part and should never be thought about it. This is a proper thing. It should not be done. Yeah. So, and now, any other question?
Yes, sir. The same student has asked, is there any eco-friendly method to destroy the drugs?
Eco-friendly, you see. Let us understand what is eco. In eco, what we say, number one, the gathering of people, those who are living in a particular colony gathering. This is one ecosystem. Second is the water bodies. And third is the land itself. Fourth is the air. If we burn it, this is the best one. Incineration, but it costs money. That is the best part, if we can burn it. And where there are huge quantities, they have to go for it. And you don't have to have that incinerator in your university or in your house. You can engage with somebody, but we have to be tracking them because they many times don't burn it, they throw here. Private agencies are there, they are authorized by the government. So the burning is the best way because everything is converted into carbon dioxide, water, sulfur dioxide, nitrogen oxide, etc., etc., etc. Second is you make a slurry of it and put into a pit. Or if there is a big body, big rivers, and your volume is not big, then with the permission of pollution control, they make certain sewerages and use it. But it is highly controlled by laws, so nobody should scatter here and there. If you put a heap of the drugs, some children, some nefarious persons, they may come and resell it or rebottle it, etc., etc. So it is the duty of the manufacturer, dealer, and everybody handling it that it is not subjected to unauthorized reuse because these are very technical things and people will not understand. They are not supposed to understand. They should be safeguarded with the help of our practices and whatever details are given on the bottles. These are.
Sir, one more question is there. एक बच्चे ने पूछा है कि we were earlier importing API from China, high dependent. Now India has imposed ban on importing API from China. How much this will boost Indian API sector? एक तो ये, and secondly क्या ये पूछ रहा है, do you think that we will be able to sustain this ban for import from API from China?
Yeah. First, I should say you should feel happy that it is a great opportunity. Those who want to go into this API manufacture, this is the, I don't think you will get ever better chance like the present. It is very golden opportunity. Unfortunately, India has been lacking. Even at NIPER also this was discussed. They were very much interested, but the thing is, the investors, those who want to open factories, they want कि आज से मैं बनाऊं और कल ये पैसे में convert हो जाए. In dosage form, it is easy because they know they have even purchased very heavy, costly material. It is closed in the vials or in the bottles in the same form or in some converted form, and it goes to the market. In API, first is investment is high, but government is supporting it. For the students, I want to say they should go for smaller, simpler things. I'll give an example. Somebody asked me what I can start. You know, your doctor in his heart, psychiatrist hospital is there near that house colony. So he wanted his some relative wanted at Sonipat. So I told him, you go simple things, one step method. If you have low investment, go for one step method. What is the one step method? I gave him an example of ferrous fumarate. You have to have fumaric acid. You don't have to synthesize. You have to have ferrous sulfate. Even if you want to make ferrous sulfate, it's very easy. Simply you make a solution, filter it, and stoichiometrically you have to mix precipitation. You have to filter and dry it. So such simple step, industry is there. Then another is we go slightly bit, I don't say this is the only one. There are in similarly, if you go bit more investment, if you can do, go for povidone iodine. These are technically simple. You don't need to buy technology from anywhere. You can improve upon whatever you have your knowledge. My class fellow who is in Jammu, he started with the API. He did B.Pharm, and today he has gone into the formulations also. So API opportunity is very good currently, And a lot of things are available, but their ready-made processes are not available. The unfortunate part is on internet you won't find. But if you have a background and if you want to develop, better is maximum 3-step for a medium scale. If you want to go beyond that, then you must hire a technology and consultant to start with that. But once you have started, the beauty in API manufacture is that the same reaction vessels are used. Number two, the reaction vessels don't have to be in a clean area. They can be under sheds. Only penultimate step. From there, the GMP compliance is required. Final step, one step before the final step. That should be protected from the environment. There, the water, air, personal hygiene, and whatever you want, like that. That has to be complied with. So the basic major structure does not require the cost, which is required in formulation. So this is a very nice area, and so many people are working for it. Similarly,
सर एक क्वेश्चन आया बच्चे का, वो पूछते हैं कि कुछ is there any other they want you to suggest some preservatives for eye drops except benzalkonium chloride.
Good. Benzalkonium chloride is a culprit basically. Some people have used it in injection also. This is a quaternary ammonium compound. It gives pain in the at the site of injection if it is used. And in Nathan Life Sciences, I got it changed. And when we contacted the person, because that company is contract manufacturer, they were making for some company, we told them, they came and discussed. They say, yes, we are getting complaint on injection. Our injection gives pain. Simply, I told them, you have to do this. Put benzyl alcohol. For eye, very good preservatives, phenyl, 5-hydroxyphenyl ethanol. 5-hydroxyphenyl ethanol, yes. ये common है, liquid है, इसकी solubility limited है, but it is used for eye, and it will give a very good flavor of rose. In the rose, the fragrance what we get is because of this 5-hydroxyphenyl ethanol. It's cheap. 1.5% to 2% you can use in eye drops. It's very compatible, being an alcohol. It is not phenol, it is alcohol. So it's very compatible to eyes and very stable unless there is some instability due to hydroxyl group, any particular group. Otherwise, it's very much one should go for this. Yes.
So there is one more question. One student has asked. She says that some companies used to practice to sell their product, they change their category into OTC and cosmetic. Is there any monitoring, regulatory?
Yeah, I know. You see, regulatory system in India is very poorly structured in terms of manpower. You see in Hisar how big this area is. In Hisar city itself, at least near to 1,000 shops are there when we total the wholesale and retail sale. And there is only one drug inspector and one senior drug inspector, right? So this OTC and first we should understand cosmetic. There's no word called Ayurvedic cosmetic in the drug and cosmetic. No license given to any Ayurvedic under the name of Ayurvedic. It can contain Ayurvedic ingredient, means plant-based ingredient or earth-based ingredient or other than APIs. Excipients which are other than APIs, they can be used in making cosmetics. And OTC drug, then it is a drug. So OTC drug means over the counter, it is again not included. OTC word is not included in drugs and cosmetics. There's a Schedule K in the drugs and cosmetics. They have given a list of substances which can be purchased without medical practitioner. And I'll tell you, for the knowledge of all students, if they are taught to this forensic, they are taught forensic pharmacy, the B.Pharm course. So they should go through the Schedule K. They must go through the Schedule K. And second thing is key, for example, glucose bottle. Where does it fall? Glucose bottle. Can I purchase a glucose bottle directly from a chemist? Yes. It is not a scheduled drug. And then if we think why it is not a scheduled drug, we will understand why certain drugs are on prescription, why certain drugs are not on prescription. It is not that except for the Schedule K drugs, no other drug can be purchased without prescription. Any drug which does not fall under Schedule H, H1, X, or Schedule G, or NRX, means narcotic drugs. Rest of them can be purchased without prescription and without supervision of pharmacist. But no license will be given unless he has engaged pharmacist. Suppose I have to sell amoxicillin, pharmacist supervision is required. I have to sell any drug, even cotton, on prescription, then pharmacist is required. But a man does not bring a prescription, wants a cotton, one can sell. The idea is when doctor writes, it means it is specifically for some treatment. And the pharmacist or seller cannot know what will be the implication there. So that must be checked by pharmacist before selling. And any drug where it is written Schedule H, it means it contains such substances. I would say you see certain vaccines, no Schedule H requirement. Because they don't contain a substance which, if taken, not supervised by medical profession, can cause any harm. Anything which can cause harm unless it is supervised medical professional, they can be sold without prescription. So all the under 548 drugs in Schedule H, it means if they are taken for unwarranted conditions, the person may face certain bad situations, adverse effects. So doctor has to choose that although this drug has this adverse effect, but his disease is like that he will choose to give it despite of the adverse effect. So scheduled drugs, they have to be on prescription. Now we say what is OTC? OTC, that is as the student is understanding, I'll talk in his language. OTC, what he understands, over-the-counter drug. This term is used in other countries, not here. But it does mean that these are not necessarily governed by the prescription. So they are being sold as a cosmetic. There are certain errors found by the licensing authorities also. Recently, they issued license under cosmetic for this hand sanitizer, which is a drug. So they should have got, now those have been cancelled. To 30th June, they have been cancelled. So the marketing people always try to bypass the restriction imposed on them. They devise language, ways, and putting, can you believe, in one of the eye drops, which was a product of a very big company in India, which deals only in eye drops. They were adding vitamin B12. And they were having competitive edge. And that B12 as excipient, they are not giving, it contains it. And excipients, glycerol, this, and B12. I put my foot down. They said, this is a big war, and they are making since years. So They came there, he tried to, we will tell to the court, Manka, sir, nobody is going to ask you why you did it. They will try you, you say whatever, you will go under its poorest category. ये एक्सप्लेनेशन यहीं इस रूम में आप बोल सकते हैं, वहाँ कहीं रिकॉर्ड में नहीं आने जो आप करें ना, आपको मौका मिलेगा, आपकी जस्ट कहाँ है, कहीं नहीं है that you can use as excipient as beta. So marketing people to get a marketing edge for interesting one. बीटा मिथासोन क्रीम सबसे ज्यादा किसकी बिकती है? ग्लैक्सोस की बेटनोवेट. So betonate used to come in cream color cotton. Betonate. So trade name is betonate. It is mandatory to write beta methasone valerate cream IP. So generic name also. In IP, this cream was not official, and they were claiming IP. I was very much confounded. Why nobody else is making? Only this is they are making. Then I checked the IP, BP. In BP, both are official, ointment as well as cream, betamethasone valerate. In IP, only ointment was official at that time, and USP both were official. I issued notice to Plexus. I was ready to prosecute. My department did not give permission, but I had given copy to the Drug Controller India. They directed the Maharashtra authorities. They had to stop. Now it comes in blue and with proper name. Now they make BP, betamethasone valerate, BP. So the bigger companies, they try to take advantage of their being big. These are marketing people, and they always study how we can say this our product is the product. ऐसी कोई product नहीं है. So regulatory का काम भी यही है. The common man is not supposed to learn this and go to details. So OTC versus cosmetics. The simple thing is, you see, its license. If it starts with cosmetic COS, it is a cosmetic license. If it is manufactured by MFG LIC, it is a manufacturing license, means for the drug. If he is claiming any API contains ye itne percent. For example, Borolin. Borolin understood to be cosmetic. No, it is not cosmetic. It is drug. And there has been a prosecution with this regard, because boric acid and zinc oxide, they are drug, they have therapeutic value. So definition, whether it is a drug or not, depends upon the intended use. If it is to be used for the treatment, prevention, diagnosis, or mitigation of any disease or disorder in human beings or animals, then this is a drug. And if it is used for beautifying and cleaning the human body, not for veterinary, for human body, then it is a cosmetic. So the marketing people, they do, they try to project this is a cosmetic, everybody can. You see, Vico Vajradanti advertisement, no? They repeat this word. This is a drug. It is not a cosmetic, right? To make a decision, or somebody can sue them. So it's there, but majority cases it is not. Yeah.
So sir, questions तो they are जो पूछे थे, relevant question हमने आपसे पूछ लिए, and इसका कोई एंड नहीं है. वैसे बच्चों ने जो पूछे थे रेलेवेंट क्वेश्चन आए वास्ट यू, बट बड़ी इंफॉर्मेटिव थी सर. आपने बहुत अच्छे एग्जांपल्स दिए. सो और भी फ्यूचर में कुछ होंगे तो हम आपसे और इंटरेक्शन करेंगे. और
you see, had it been a gathering, then things are more understandable, no? It is through online. Yes. You see, I'm not able to see their reactions, no facial reactions. Anyhow, we have to be used for this method, and it has so many advantages. You see, nobody has to go out from his place. So, Dr. Munish, you are doing really very wonderful job. Yes. I'm really happy, and I thank Madam Niru Vasudeva for.
आपने जो एग्जांपल दिए हैं बहुत अच्छे रहे, हमारे बच्चों को उससे काफ़ी हेल्प मिलेगी फॉर देयर रिसर्च वर्क आल्सो। सो तो आपने बड़े सिंपल आइडिया, आपने इतने सिंपल ढंग से बताया, तो बातें जो है हमने भी काफ़ी सीखा है, मेरे कोलीग्स ने भी सीखा होगा। मैं रिक्वेस्ट करता हूँ मेरे कोलीग, मेरे जो को कोऑर्डिनेटर हैं डॉक्टर विक्रमजीत सिंह, टू प्लीज़ कम लाइव and express his vote of thanks.
So nice. Thank you.
Thank you, sir. So, on behalf of Department of Pharmaceutical Sciences, I am highly thankful to Shri Rajendra Harna ji, sir. He has been so kind to spare time for us, and he has given very valuable instructions and tips to the students so that they can enhance their skills in research as well as their academics. He has given very small ideas which they can use to pursue their research work, and we hope he will be there to help them as and when required. And all the faculty members are also thankful to him for his suggestions from time to time. I am thankful to the participants as well as they have been very patient in listening this talk, and I am thankful to Chairperson Niru ma'am and Professor Munish Ahuja sir, because he is the one who is regularly taking pains to arrange these different seminars and conferences and these online webinars for the students, which will benefit them in their career progression. Thank you, sir. Thank you very much, sir.
Thank you. So nice.
Thank you, sir. Thank you. We are highly grateful. So, dear participants, now we finish our task here. Talk here. Thank you for coming here. Thank you, sir. So, I am ending the session. Thanks.